Okay, so another thing that makes DeWitt Physical Therapy different as far as how we approach sports medicine is our use of blood flow restriction training. You might have heard of this called BFR. Effectively what we do is we take a surgical grade tourniquet and we use it to occlude the blood flow in either the arm or the leg. We always want to put it up nice and high. It'll have a systemic effect where we occlude either 80% of the blood flow in the leg or 50% of the blood flow in the arm. And what that'll do is we have two different types of muscle groups. We have our endurance muscles, which are our type 1s, and we have our speed and power muscles, which are our type 2s. Now we know that to really get somebody back to sport, we got to get into their type 2 muscles. But that's really hard to do with entry-level basic exercises, right? So you think someone's just going to get back to snatching and doing like a bunch of crazy overhead presses or squatting 500 pounds, just doing like really easy rehab exercises? Not going to happen. So we use the BFR to effectively occlude the blood flow. It creates a hypoxic environment. What does that mean? It means that we choke out, we take the oxygen away from those endurance muscles, so it makes the type 2 muscles have to kick on. Usually you have to load somebody at 80 to 85% of their 1 rep max and do it a lot of volume to get those type 2s to kick in. With this, we can actually just occlude that local region, that muscle group or body part, and we can get those type 2s to kick in using anything from just gravity or the weight of their arm or their leg, all the way up to like 20 to 30% of their 1 rep max. So we don't have to work very hard and we can get the same benefits of pushing somebody super hard, super heavy. And again, throughout their rehab, that's important because we can't always load them because we're waiting for tissues to heal and all that stuff. All right, so we're going to show you how this works. So we got Elijah over here. We got a cuff on his leg. So we're going to pretend that he is early post-op on a knee surgery, so say like an ACL. So we got that there. The machine's all set up. I'm just going to have Elijah start with just kind of squeezing his quad, holding for a second, then relaxing. And then I'm going to have him progress into doing like a straight leg raise. For Justin here, we got a cuff up on his arm. We're going to pretend that he's got a shoulder injury or even like a post-op shoulder that we can exercise, but we can't really load just yet. I'm going to have him start with just some sideline external rotation. And while these exercises look really easy, normally if I had them do it, we would never get into those type 2 muscles because they're so easy that just those endurance muscles are having to work, those type 1s. So we're not going to get into those type 2s. But when we use the cuff and we choke out those type 1s, even just doing these basic against gravity exercises, because of the effect that it has on that local musculature in that entire shoulder girdle and that entire hip and lower leg, we're kicking in those type 2 muscles and we're getting a strong rehabilitation effect out of it. Okay, let's progress this. Let's go to the next phase of rehab. I'm going to have Justin just add some weight. So now we can load him, and let's say he's getting pretty darn strong. I'm going to give him a small weight and have him do BFR with that weight. That weight is going to feel 10 times heavier within a few reps, which is great. Make those muscles really burn and fatigue, which is what's going to help them grow. It's going to give the neurologic response that we want. It's going to give like the growth hormone response that we want. We're going to build muscle, build strength, all the cool stuff. For Elijah, we're going to come on over here. We're going to, again, this kind of middle phase of rehab. I'm going to put him on some knee extensions just to really pump that quad up. And same thing, it doesn't have to be a lot of weight. Elijah's a strong guy, but just doing some knee extensions with that BFR, it's going to be a whole lot harder. So again, it's going to choke out those type 1s, make those type 2s have to work. Okay? All right, so this would be more like a middle phase of rehab. Let's go late phase rehab. Okay, come on off there. Justin, come on up. I'm going to have Elijah do some goblet squats here, and I'm going to have Justin do some ring rows. And Justin, you can make those ring rows as hard as you want to make them, as long as that arm's still working. Now granted, we wouldn't do this boom, 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 all three. There's a whole rep scheme and everything like that. But just want to give you guys an idea that this is something that's scalable from early rehab all the way into late phase. And this is how we build strength. This is how we build muscle size, which is super important after surgery especially, and especially ACLs. And we can use this to help push performance. We can make them work smarter. We definitely are making them work hard, but we can make them work smarter where we don't have to load them. I don't have to put 300 pounds on Elijah's back. I can give him 30 pounds, 50 pounds, and have his muscles and his body feel like it's doing a whole bunch of load. So that's really where this stuff is special. This is something that we do with so many of our patients. It even overflow into, hey, I've just had this like nagging hip thing or nagging knee thing, or maybe I got like some shoulder tendonitis, or I got some, golfers or tennis elbow. There's a lot of benefits in the tendinopathy pathologies as well, as far as how do we manage those and get people stronger. There's a lot of benefits for just kicking on more muscle and muscle fibers and more like muscle groups to try to get people as strong as we can, as quickly as we can. So we can use this all through rehab, again, starting really low down and all the way up until they finish and they're going back to sport. So that is how we use BFR here at DeWitt PT. And again, we use it across all different demographics and populations.